Good afternoon, everyone, and welcome to my Friday message. Let's start with COVID update. The number of COVID cases in the United States likely peaked last week, and as predicted, based on other countries, are coming down. As you can see, the pattern does differ in different regions of the country, with the South lagging behind the Northeast. We may be at a peak plateau in North Carolina, but it's too early to tell. Unfortunately, the number of hospitalizations in the state is at an all-time high, reaching 5,000 this week. However, the percent of those hospitalized and requiring intensive care is overall lower in this surge and is trending downward. At Duke, we still have more than 300 patients with COVID across our system that are hospitalized. Fortunately, the number of our employees testing positive and out from work has trended down, although there continues to be enormous stress on our health system. If you look at hospitalizations across the country, it remains that the majority are not vaccinated, and that is true in our hospital, where 88% hospitalized have not received their full vaccine schedules, including a booster. The protective efficacy of the vaccines continues to be demonstrated by a differential mortality as well, with mortality 20 times higher in those unvaccinated. Several reports last week, including a CDC report, demonstrated a clear beneficial effect of a booster for enhancing protection against both Delta and Omicron infection. Receipt of a third vaccine highly effective at preventing COVID-19 associated emergency department and urgent care encounters, 94% and 82% respectively for the two strains, and preventing COVID-19 associated hospitalizations, 94 and 90%. To understand the mechanism of this continued protection against serious disease despite the multiple mutations, a recent study demonstrated that T-cell responses, an important aspect of the protective host response, remains quite effective against Omicron, even when originally elicited by a vaccine or infection against a different variant. This data highlights the importance of getting a booster shot, and it's not too late in this surge to benefit from a booster. Recent modeling study estimated that accelerated COVID boosters between January 7th and April 30th could result in a dramatic number of lives saved and hospitalizations avoided. Currently, less than half of those eligible in the U.S. have received a booster, with only about a quarter of the total U.S. population fully vaccinated. And in North Carolina, 46% of our population has received a booster. At Duke, we are making great progress. Currently, 82% of faculty and staff across the university, 80% of health system employees, and 89.8% of faculty and staff in the School of Medicine are compliant with the booster policy. So just a reminder that all Duke University health system and PDC employees are required to show proof of a booster by February 15th or within 28 days of their eligibility under CDC and state guidelines. For employees who recently tested positive for COVID, you can safely get a booster after 10 days of isolation. However, if that infection has been since December 15th, you can also opt for having an additional 30 days to receive your booster following your release to work. If you've received monoclonal antibody treatments for COVID, you would need to wait 90 days to get any COVID vaccine or booster. Remember, if you receive your booster in a Duke clinic, such as a primary care physician's office, or if you've received your booster in the community from a pharmacy or health department, you must submit an image of your booster vaccination documentation through the confidential Duke VaxTrack system. So please, if you've not gotten your booster, please plan to do so and encourage your loved ones to do as well. And in closing, a reminder, don't miss Duke Research Week 2022 next week. Events begin Monday and run through Friday. During this star-studded week, many of the panel discussions and events feature School of Medicine faculty, students, and trainees talking about topics including advancing brain science, social policy implications of COVID, and licensing, ventures, and corporate partnerships. The week begins on Monday morning at 11:30 with a Robert J. Lefkowitz lecture featuring Huda Zogby. So you can see the full lineup of speakers and register to attend at dukeresearchweek.vfairs.com. Thanks to all of our faculty, staff, and students, and to our colleagues in the health system and across the university for all that you are doing. I'll be back next week to share new information.